For effective living, accelerating nutrition results in Nigeria, ANRIN organized a public lecture to Sensitize Christian Association of Nigerian CAN on maternal, infants, and young child nutrition issues for Greater Nigeria. Representing the CAN president, Archbishop Daniel Oko, in her address, the Assistant General Secretary of CAN, Mr. Bako Williams, expressed excitement over the project as it aims to address the nutrition challenge facing our nations, as nutrition is not merely a matter of sustenance.
How do we accelerate nutrition results in Nigeria? Some of us here are representing churches, some of us here we are representing schools, some of us here will deal with children, some of us will find ourselves in situations where children are the ones that take the crumbs that falls from our table. We find ourselves in a situation where we get the best meal and only the leftovers are for children. We find ourselves in a situation where the fathers of the house take the chunk of the food and allow the children to take little because they are children.
The National Directorate of National Issues and Social Welfare, Prophet Bimbola Ayoba, retired, in his speech dwells on ANRIN projects and its objective, saying it is to increase the utilizations of quality, cost-effective nutrition service for pregnant, adolescent girls and children across the nation.
The Accelerating Nutrition Results in Nigeria, ANRIN, is a World Bank finance project implemented by the Project Management Unit of the Federal Ministry of Health. The objective is to further sensitize faith actors to understand the necessity to provide the right level of nutrition for women through pregnancy and infants as they appear within the first 1 hour. Teach them the necessity that the baby must be put to breast within the first 1 hour of birth.
Speaking to newsmen, the Assistant General Secretary of CAN, Reverend Bako Williams, credited their workshops to be very timely, as it is an opportunity for all to learn new things and unlearn negative norms.
This workshop is going to be an opportunity for us to learn new things, unlearn these norms that are very negative, and then relearn, get something that is very important that will guide us to actually understand the need for us to pay closer attention to some of these people in this category. Pregnant mothers, they need attention. Nursing mothers, they need attention. Young children, in fact, they need attention. What they eat, the environment they grow up, this will influence who they become in the future.
Meanwhile, the project manager, ANRIN Social and Behavioral Change, SBC, Bako Kantiok, emphasized on the project and some of its challenges.
The essence of this project is to see how we can leverage on our religious institutions and religious leaders to leverage their credibility and the platforms that they have to try as much as possible to promote positive behavioral norms that will lead to a change and turnaround on our nutritional fortunes. Most of the challenges that we've had are some social-cultural practices or norms that have negated practices that should ensure proper nutrition of babies and pregnant mothers. We notice that there are some cultural practices that, for instance, if a child is born, some people or some families or beliefs have it that probably is not in their interest to exclusively breastfeed their child.
Fonobong Sunday, ITV News.